Today, we are going to talk about growth scans and non-stress tests, which is all a part of routine testing towards the end of a woman's pregnancy. As a pediatric nurse and a mom of two, I know how important it is to have a good understanding of what to expect during pregnancy. So let's dive right in. Hey, it's Morgan. Welcome to the Passable Parent channel. I've been a pediatric nurse for the past decade, specializing in early childhood development, and I'm also a mom of two. Before we get started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. And make sure to comment down below if you have any questions. I'd love to hear from all of you. Thanks so much for your support. So what is a growth scan? A growth scan is a type of ultrasound that is typically performed between 32 and 36 weeks in pregnancy. The purpose of the scan is to evaluate the growth and development of the fetus, as well as check for any potential complications. Why is a growth scan ordered? A growth scan may be ordered for a variety of reasons, including low or high birth weight. If your baby is measuring smaller or larger than expected based on your due date, your doctor may order this growth scan to get a more accurate estimate of your baby's size. Another reason is previous pregnancy complications. If you have had complications in a previous pregnancy, such as preterm birth, your doctor may order a growth scan to check for any potential problems. A third reason is gestational diabetes. If you have been diagnosed with gestational diabetes, a growth scan can help monitor your baby's growth and ensure that your baby is developing properly. So what can you expect during a growth scan? During a growth scan, you will lie down on an exam table, and a technician will apply a gel to your abdomen. They will then use a transducer to capture images of your baby. The scan typically takes about 30 minutes, and you may be able to see your baby on a monitor during this procedure. It's very similar to the 20-week anatomy scan, which I also made a video on for you, and you've probably already had that done in your pregnancy at this point, so it's very similar to that, only your baby has grown more, so it might be harder to get a full picture and great images of your baby. Usually we get the best images of baby on that 20-week scan. So what information does this growth scan provide? A growth scan provides a lot of important information that can help your doctor monitor your baby's health. This scan can provide measurements of your baby's head circumference, abdominal circumference, and their femur length. These measurements can help your doctor estimate your baby's weight, which can be used to determine if your baby is growing properly. The scan can also help your doctor evaluate the amount of amniotic fluid around the baby, as well as the position of the placenta. These are two really important factors to make sure your baby is getting the proper amount of nutrients that they need to continue developing properly. Overall, a growth scan is an important part of the prenatal care, and it can provide valuable information about your baby's health and development. If your doctor recommends a growth scan, don't be afraid to ask questions and seek additional information. Understanding what to expect during a growth scan can help you feel more prepared and confident as you prepare to welcome your little one into the world. What is a non-stress test? Typically, a growth scan and a non-stress test are ordered together. A non-stress test is a simple, non-invasive test that is typically performed in the third trimester of pregnancy. It is used to evaluate the health and well-being of the baby and to monitor their heart rate. Why is the non-stress test ordered? A non-stress test may be ordered for a variety of different reasons, including high-risk pregnancies. If you have a high-risk pregnancy such as gestational diabetes, preeclampsia, which is high blood pressure, or a history of preterm labor, your doctor may order a non-stress test to monitor your baby's health. Another reason they would order this test is if there was any reduced fetal movement. If you notice a decrease in your baby's movement, or if your doctor is concerned about the amount of movement, please call your doctor if you feel this decrease in movement. Your doctor may then order a non-stress test to evaluate your baby's well-being. I cannot encourage you enough to call even if you aren't sure, because you can never be too careful. I think it's better to just go and know for sure than to leave yourself sick with worry and anxiety at home. Another reason that your doctor would order a non-stress test is if you're overdue in pregnancy. If you go past your due date, your doctor may order a non-stress test to monitor your baby's health and ensure they are not in any distress. I also cannot encourage you enough to make sure you're getting non-stress tests if you decide to go past your due date, which is a totally personal choice. The reason why I encourage you to keep getting these non-stress tests is because the placenta function can actually deteriorate, and that is how your baby receives nutrients to keep them developing properly. So it's really important that you go get these non-stress tests done, and it can really check to make sure your baby's still doing really well and that everything's moving along just as it should be. What can you expect during a non-stress test? During a non-stress test, you will lie down on an exam table and a technician will apply 2 belts to your abdomen. One belt will monitor your baby's heart rate and the other will measure any contractions that you might be having. This test typically lasts about 20 to 30 minutes and you may be asked to push a button if you feel your baby moving. So what information does a non-stress test provide? A non-stress test provides important information about your baby's well-being. The test measures your baby's heart rate as well as any contractions you may be having. If your baby's heart rate increases with movement, this is a sign that they are healthy and responding well to stimuli. If your baby's heart rate does not increase, or if there are any other signs of distress, your doctor may recommend further testing or intervention. Overall, a non-stress test is a valuable tool for monitoring the health and well-being of your baby towards the end of pregnancy. It is a simple, non-invasive test that can provide important information about your baby's health, and it can help your doctor make informed decisions about your care. If your doctor recommends a non-stress test, don't be afraid to ask questions and seek additional information. Understanding what to expect during a non-stress test can help you feel more prepared and confident and provide reassurance that your baby is thriving. I hope this video was helpful and the footage seeing me have these tests performed during my pregnancy helps put you at ease and shows you exactly what it is to expect with either one of these tests. Make sure you're subscribed to the channel so you don't miss out on future videos like this one and all things early childhood development and giving your baby the best start possible. Thanks so much for watching. I'll see you in the next video.